Thank you. Check, check. Maybe. Coworker.
There's a few minutes away.
Well, let me assist on that front. I can go on and on and on. Is it working?
It's working.
Okay, good. All right. Moving on to our next item is the introduction of new staff. Hi, Lily. But I'll pass it over to Allison to pass it over to John to pass it over to Lily. Probably.
I'll introduce everyone. Yes, we're very thrilled to welcome 2 new members to the team since our last meeting. Lily Gruber-Schulz started as our adult mental health case manager on April 22nd and is deep into onboarding and learning and doing fantastic work already. We're so thrilled to have Lily as a part of the team. That position was vacant for over a year, so really critical hire for our department, for our community, and just see Lily driving that role in her early months. We also just yesterday welcomed Leanne Avery to the team in a full-time capacity. She's been doing some onboarding while transitioning out of her role as the community center assistant. Leanne again brings excellent institutional knowledge from her years of service at the community center and fantastic customer service. Just thrilled to have both of these fine staff joining our team.
This gets better and better. Thank you both very much for joining. And I didn't mean to. I just always, consider you part of the team. So it's not a new member to the team, but there are different teams, and my team lines blur. So, but thank you as well. And Lily's a Cook County graduate and back home, and just really thrilled for that full circle. So thank you again for joining the team. Anything you guys want to say? You don't have to. Oh.
Really, no.
Okay. Well, thank you for being here, and again, assisting our community in the ways we need the most. So, that's both item A and B there, under 3 for the introduction of staff. We can move on to item 4 here for staff report, and this is our financial report for PHHS, and we have Plamen here this morning. Good morning.
Good morning. Thank you for the opportunity to present the financials for Cook County Public Health and Human Services Department for year 2023. Good morning all that are present and those who are joining us online. For those who don't know who I am, my name is Plamen Dimitrov and I'm the Fiscal Supervisor for Cook County Public Health and Human Services. I do want to acknowledge Lori Erickson, who was my predecessor and carried the load of Fiscal Supervisor until about halfway through 2023. So thank you, Lori.
Big shoes and paved the way. Right?
Yes. Yeah. Sure. So I'm going to be moving through the slides on my computer and here, so be patient with me. The full year-end financial report is attached to today's agenda and available online. This presentation will explain the graphs and charts from the report and will provide more context to the numbers. I will pause for questions after each department. Page 1 of the financial report, this kind of provides an overview of the financials for 2023. Revenue received was 5% less than the budget. Some of our federal and state aid is based on the amounts of personnel expenses that we report, such as wages, training and travel, supplies, software licenses, or program materials. Since we had reduced personnel expenses due to vacant positions, our reported costs were less, and our federal aid was reduced. We had also budgeted to use some of the federal funds from the American Rescue Plan Act, or known as ARPA, to support the crisis response pilot project, but we found other funding through the Adult Behavioral Health Initiative. Overall expenditures were 14% more than the budget. This was largely due to the increased adult mental health placement cost and increased out-of-home placement costs. We had budgeted to use $656,881 of fund balance. We have an excess of expenditures paid over the revenues received of $830,600. This is the amount of actual use of fund balance. Any questions so far?
Sir?
Yes.
Just to clarify, that over expenditure in the social services was both adult mental health and then out-of-home placement, right? That's kind of the bulk of.
Correct.
Yep.
We will get to a more detail down the road, but those are the two biggest items that cause the overage.
Thank you.
Yep, thank you. I'm going to go through the funding sources. That's still on page 1 of the financial report. PHHS funding comes from these specific areas. Federal and state grants and aid made up to 42% of our revenue in 2023. Fees and recoveries, including reimbursements from health insurance plans and license fees, made up to 7%. A small amount of revenue came from non-governmental grants and donations, 2%. And the remaining 49% of our revenue came from the county tax. Now, in reality, the county tax percentage is actually smaller because we tapped into the reserves to fund 60% of the total cost. But one may argue, well, where does the fund balance come from? So I wasn't going to go through a very complicated and maybe inaccurate calculation of what percentage of the fund balance comes from tax and what comes from, so I'm saying here that 49% comes from county tax. Still on page 1 of the financial report, all of the PHHS expenses fall into one of these 3 departments: social services, public health, which includes community health grants and child care program, or economic assistance. I think that there is some benefit in the year 2025 to separate the child care program and be in its own department in our finances per se, because it's its own program and it's not really managed by the public health supervisor. So I'm contemplating separating that in the budget and presenting that, unless I hear different guidance from the board or from my director.
Yeah, what do you guys think about that?
Well, I noticed that further along in the report, you did separate out, and I appreciated that.
Yeah.
It makes it more clear and easier to track.
Yeah.
Yeah, I like that idea. I think it makes sense.
And it's,
Okay.
it's also congruent with what the state is doing, right? With the Department of Children, Youth, and Families being a separate department and kind of going through that transition, or am I misinterpreting maybe the appropriateness of that?
Could be, but I'm going from our internal operations. That would make more sense too,
Okay.
because, like I said, for one thing, the the public health supervisor doesn't really oversee the child care program. On the other hand, we also, not on the other hand, but similarly, our finances, it's a completely different department within our financial software. So I think it helps to have it separated. Okay, I'm gonna move on to the organizational chart for public health. I'm gonna go through the entire department and then briefly go through each of the teams within. I'll pause for some questions if there are any, and then we're gonna dive into the numbers. This is the PHHS organizational chart at the end of 2023. On paper, it looks like a lot of staff. However, there is a little or very little overlap of or redundancy in services. Rather, many of these staff wear multiple hats in their public services role. As I go through each department in the report, you'll hear more about the work each team provides. I gotta remember to move both. Social services is comprised of 3 teams: adult and home and community-based services. Has 1 supervisor and 6 social workers. each with a different case management or care coordination specialization, providing adult protection, waiver case management, long-term care services and supports, intellectual or developmental disability services, and mean choices assessment. And one social services case aide who supports this team. This team also has several independent contractors who provide in-home support services to the aging population. Social services, children and family services team. The team consists of one supervisor and two social workers providing child welfare and child protection services, family assessment response, and parent support outreach services, and one child care licensor who in 2023 is also the community child care coordinator. The social services case aide also provides supports to this team. Arrowhead Economic Opportunity Agency, AEOA, is under contract to provide employment and training services to people on the Minnesota Family Investment Program, MPIP, and the Diversionary Work Program, DWP. Any questions so far? Okay. Moving on to John's team, the behavioral health team. John is the supervisor of the team with 4 social workers providing substance use disorder services, children and adult mental health case management, and therapeutic support services, and 2 mental health workers, 1 providing adult mental health and 1 piloting a crisis response collaboration project. Again, social services case aide provides support to this team as well. Contracted providers for this unit, contracted provider for this unit is the Wilderness Outpatient for comprehensive assessment, outpatient treatment, and inpatient substance use disorder referrals. The public health team, 1 supervisor, that's Grace, with 3 public health educators to meet all 6 areas of Minnesota public health responsibility within the local Public Health Act. The office support case aide provides additional support for this team as well. This team provided regional collaboration, grant writing, contracts management, emergency preparedness. During the pandemic, the public health team played a major role in vaccine planning and implementation, case investigation and contract tracing, and liaison to the school and businesses, as well as the coordination of many community volunteers with the shift to infectious disease control and prevention post-pandemic. Using contracts with Southwood Mountain Clinic and North Shore Health, Cook County provides several additional public health programs such as the home care sliding fee, child and teen checkup, family home visiting, and WIC. Okay. Moving on to economic assistance team with Dagmara being the supervisor currently, and I think she stepped in a role in December of last year. The economic assistance team consists of 1 supervisor and 4 eligibility specialists who provide eligibility determination and revalidation reviews for many state and federal support programs, such as cash and food assistance, housing support, several health care programs, child care assistance, and process applications for emergency assistance and county-funded burial support. 1 case aide provided coordination of the health care access program. This program is in transition to MTM, which is short for medical transportation management. Child support services in Cook County are provided through a contract with Carleton County. Moving on to administration. Since it was the Administrative Professional Day on 4/24, I would like to acknowledge our administrative staff for the important work that gets done behind the scenes every day. This includes our director, Allison, providing agency management and leadership, and local, regional, and state collaboration. 1 executive administrative assistant, Melissa, thank you, and 1 office support case aide. The admin team members support our Citizens Advisory Council, order supplies for our office and programs, maintain the PHHS social media and outreach. The administrative team also includes the fiscal services with 1 supervisor, fiscal officer, and accounting technician. Morning.
We'll take that adverb, more or less, yes.
We develop the budget, pay the bills, receive the revenue, operate the Social Security REP program, provide complex grant management and reporting, and provide regular financial updates to this board. I want to give kudos to my team for the work they do. Okay, on page 4 of the financial report, you'll be able to see the administrative allocation costs. These are costs that benefit the entire agency and split between the 3 departments, and they include the admin wages, postage and copy costs, office supplies, and phones, training and travel for admin staff, travel and per diem for advisory board members, fees to the state of Minnesota for the merit systems and other services the state provides, as well as funds transferred to the county general fund for courthouse office rent, county MIS cost, and labor and liability insurance, also cost of the annual audit. As I go over details for each department, you'll notice a line item in each budget for administrative allocation, as these admin costs are split proportionally between the economic assistance, social services, and public health departments. On page 5 of the financial report provides overview of the economic assistance team. The 2023 actual cost and revenues were within 93%. I think this should say the actual costs were within 93% of the budget. My note isn't very clear here. The biggest variance can be seen in the client programs, where we saw a decrease in reimbursement cost, as a result decrease in state and federal revenue. The amount of federal administrative revenue for child support services was slightly higher than expected, but the overall budget to actuals were on target, with the revenues exceeding the expenditures by $43,727. So this department returned to the fund balance. There was excess of revenues over the expenditures. Okay? Any questions so far? Okay? On page 7 of the financial report, you'll see cost versus reimbursements for the client-related programs. There was a decrease in the client program cost in 2023, with only 76% of the budget utilized, and thus the corresponding decrease in the reimbursement. But the revenue comes from the state reimbursable assistance we provide to clients. Now, there's 3 specific client-related programs. The county provides assistance for cost-effective health insurance and Medicare Part B insurance premiums to eligible recipients, and we received nearly 100% reimbursement in return from the state and federal sources. Provided transportation allows community volunteer drivers to assist eligible elderly clients with medical rights. PHHS direct bills and receives reimbursement from managed care organizations, with reimbursement rate varying depending on the loaded or unloaded mile.
I'm sorry, what was the last?
Loaded or unloaded mile, depending on whether the client is in the vehicle or not.
Oh, okay.
Okay? Healthcare Access provides assistance to eligible residents to reimburse them from using their own transportation and medical lodging. The state reimbursed us 89% of these costs. Any questions on the cost versus reimbursement within the 3 programs, client-related and economic assistance?
So the reimbursement rate is a formula and not a matter of delayed payments or something like that?
It's a good question. There is different timings of how this billing happens. With the cost-effective insurance, we enter these obligations, or we ask the state to pay us almost immediately after these have been approved by our staff through a state-operated system, whereas, for example, the provider transportation and the healthcare access, we have to incur the expense first and then submit the claim. So there is some delay between the time we make the payment and we receive the revenue. So these are almost never going to be at 100% like the cost effective is, because of the timing of the billing and the time we receive the revenue. We still continue to receive, or continued to receive revenue in April for services in 2023, but because we can only account revenue received for 2023 only through the month of March, we couldn't include those in the finances for 2023. Does that make sense?
So, yeah, that's what I was wondering,
Yeah.
as far as accrual numbers, and then
Yep.
it's just a matter of the state not paying on time then?
Well, there is that, but when we talk about, for example, the provider transportations, these are good questions. The provider transportations we receive from the different managed care organizations, different rates. For example, I'll take Blue Plus, for example. For Blue Plus, we get, for a loaded mile, we get 100% reimbursement and 0 reimbursement for unloaded mile. But we do get the pickup charge for each leg, which is supposed to offset the unloaded mile. Not always that it does. That's why we see that we're not 100%. With UCare, they pay us a lesser rate per loaded mile. Again, unloaded mile is not paid. And a lesser amount for a pickup charge. But we do have, most of our clients are enrolled with one of those companies and not the other. So, yep. All right. The funding sources for economic assistance team can be found on page 5 of the financial report. Federal state funding made up to 58% of the revenue received for economic assistance.
I'm sorry, it's just, I'm still processing the last conversation, and I really appreciate it. So it's, when we're talking about county services, I think it's really important that we talk about what's reimbursable and what can be reimbursable and where it's not reimbursable and all that. And it's helpful for me to understand exactly what you're asking about timing and just formula or how that works. And also kind of looking at our overall picture with our costs with the out-of-home placement and the adult mental health, right? Like, we're also looking for things that are not fully reimbursed. Whoops, sorry. Yeah, now I lost my. But just for perspective, you know, like for the provider transportation, right? That's like $2,000 that we're not reimbursed for, or maybe we will be, but not yet, right? In this report, or is this?
It comes after March 31st.
Well, that is that too, but in the provider transportation, we are almost never 100%
Right.
reimbursed.
Okay.
But this is a service we provide to
Yeah. Well, I was just-
all the residents of Cook County, because some of them don't have a choice other than that.
Yeah, no, thank you.
Yeah.
I was just, in my mind, again, trying to be strategic and be like, okay, like, we need to provide these services. Maybe I'm not going to get caught up in that $2,000 though, because in the bigger scheme of things, there's some other numbers. And similarly with the healthcare access, right? We're not fully reimbursed there, but there we're talking another like $2,000 or $2,500. So it's like minimal cost to the county, but it's still a cost to the county, right?
That, however, I must add that on the healthcare access, we receive 100%.
Well, oh, thank you.
It's
I'm still learning, yeah.
Is almost 100% due to timing.
Thank you.
Yeah.
Okay, sorry to interrupt there.
Okay. Thank you. Moving on to the economic assistance funding sources, which can be found on page 5 of the financial report. Federal and state funding made up 50% of the revenue received for economic assistance. This includes federal administrative aid, which supports some of the payroll costs of staff providing the eligibility services for state and federal programs, as well as reimbursements for county-paid client assistance. Fees and recoveries made up to 2% of the revenue. The county is required to perform collections on behalf of the state, and in return allows us to keep a token portion. The fees and recoveries also includes county burial recoveries, which are the county retains, and the remainder of the funding came from county tax. This slide shows the new applications for programs under economic assistance in 2023 and compared to a 5-year average between 2018 and 2022. And there were 222 new applications for assistance in 2023, and this is significantly higher than the prior 5-year annual average of 210 applications. All but one category saw an increase. The largest increase came from people applying for food assistance. Child support open cases. Since 2023, child support services are provided by contract with Carleton County, providing case intake and assessment, establishing paternity, locating absent parents, establishing and enforcing orders for child support and spousal support, collecting on current orders and on cases arrears. The 2023 stats show a slight decrease in cases, 119 versus 126 in 2022.
Can we talk about this trend? Just what our takeaway from that is, what's contributing to that, and the success or the challenges, and do we have any further insight there? Or?
I really don't.
Okay.
We contract with Carleton County to perform those services. For many years, they kept their contract under for the same amount. They made a slight increase in 2024 and going forward of $3,000, which is a small percentage. But, of course, since they've had staff wage increases and other costs too. So financially, I don't really can provide any background, but if Allison has something she'd like to add on.
Yeah, no, I guess I was more curious just about the decrease in open cases, right? Like, that's good,
Good news, yeah.
right? Like,
Yeah, this is challenging for me to comment, not
Sure,
having the
okay.
direct oversight
Yeah.
of the child support team as Carleton County is managing this. I would be happy to reach out to their supervisor, Dan Plinsky, for some comments on what's
Sure.
driving the caseload changes and bring a report back to the next meeting.
Yeah.
I can make some assumptions, knowing that healthcare programs is one of the programs that would initiate a child support referral, and we've seen a lot of dynamic changes in healthcare programs statewide with some of the waivers that were in place during the pandemic. Seeing, dropping caseloads in healthcare might, correlate with that drop in 2023, but that's just conjecture. I would want to verify that with Dan and
Yeah,
come
I
back
w-
with a more accurate report.
yeah, I won't hold you to that, and that would be great if we could get that. And so, but just to make sure I'm understanding what you said, it's possible because of the waivers for the renewals that there haven't been an increase in open cases, basically because we haven't been asking, or?
We haven't had new applications
Yep,
because
yep.
people remained eligible.
Mhm.
And now that people are renewing, that
We'll
could
see
be
what-
driving a decrease in child support charging as connected to those healthcare cases.
Okay.
When there's an absent parent.
Thank you.
The Social Services Department, that detail can be found on page 8 of the financial report. For all 3 units of social services, costs were 16% over budget, and revenues were received were 11% less than anticipated. $341,608 of fund balance was budgeted to be used. $708,465 of fund balance was needed. Several vacancies remained unfilled at year-end and into 2024. This lead to reduction in personnel costs and associated federal and state aid. The biggest variances were Children and Family Services, including our home placements expenditures exceeded the budget by 59% due to increased number of children in our home placement, with 14 children in our home placement in 2023 versus 8 in 2022. That was approximately 75% increase. Mental health services expenditures exceeded the budget by 203% due to mental health placement in a state-operated mental health facility for client care with over $443,454 expended. On the revenue side, some of the state and federal allocations are based on expense data or client counts from prior years. We did receive more revenue for foster care aid than budgeted in 23 because the budget was based on previous numbers, but we had higher numbers in our home placement. So, and administrative aid for comprehensive assessment was lower than anticipated. Lower reimbursement revenue in our program areas correspond to lower expenditures. I'm going to pause and ask for any questions on the social services expenditures and revenues.
Shirley, please.
So out-of-home placement, mental health placements, are those reimbursable?
The out-of-home placements for children, we do receive some reimbursement from the federal government and the state, depending on whether the children qualify for 4E.
4E? What?
Yeah, the foster care. The mental health services are not reimbursable. We do, I shouldn't say that. They're reimbursable to some extent, but not 100% reimbursable. So a lot of these funds came out of tax dollars.
And can you elaborate on what makes it reimbursable and what, or not?
Well, we report our expenditures to the state through a quarterly, and they reimburse us based on a state averages and based on a lot of different components. But when I reached out to the state asking, because when I first started, I was starting to see that our mental health service expenses were going up, and they were continuing to, the bills were continuing to come. I reached out to the DHS financial liaison, and I asked, are those reimbursable? Can we claim them in any other way other than on our quarterly reports, which only reimburse at a small reimbursement rate, again, based on the state average and other factors that are beyond what our, beyond our power. Julie Spurgeon, her name is, she said, no, not really. Those come from county tax, unfortunately. So
the question in my mind is, what can we do as a county to get ahead of that cost, right? Like, this is a huge cost. It's fairly unpredictable, but there are certainly things we can do ahead of time. And I think we're doing pretty good work in those efforts, but clearly there's more work to be done.
That might be an issue for an AMC to, we must not be the only county dealing with this issue.
Every county, actually, yeah. So it's, I think, and that's, yeah.
But I'd say possibly a child or family receiving mental health services, which costs us some amount of money, is preventing something like foster care, which would be way more money. So I don't see this as a bad thing, that we're providing these services.
No.
People need them, we're providing them, and
Right.
that's what we need to do.
Right, I guess where I was going is just like, is there, like you're saying, we're providing the services, is there more we can do to prevent the higher costs too?
Yeah.
You know, if we're looking at, I mean, there's more than just the dollar way of looking at it, but that certainly is a driver. And, yeah, we've made efforts in that direction. It's just what more can we do? Yeah.
We would need to intervene in a different way or more often to prevent those issues
Yeah.
from ever coming up.
And some may be non-preventable, right? Like this
Right.
is, yeah,
Sure.
but, yeah, when we're talking about, $390,000,
But also-
that's a lot of, that's like three positions, right? If we had 3 more staff, would that cover it? Maybe not, you know, we can't prevent everything, but if we put 1 more staff towards it, how much more would that do? Not that we have staff coming out our ears by any means, in the community, but, you know, that's where I start to think like, okay, these are big costs, and what can we do and maybe it's the state, more of a state conversation about what support that the state's giving us, but yeah, it's big. I'm sorry, Rand, I kept
That's okay.
talking, but you,
Well, and, you know, there again, I mean, it's been a stressful couple of years for everybody with COVID and everything, so I mean, there's that too. It's,
yep,
you know, and that hopefully is improving now.
yep. Any other thoughts, or?
If I may, Commissioner.
Please.
There are, to Commissioner Johnson's point about reimbursement for adult mental health placements, if an individual is enrolled in a Minnesota healthcare program or a prepaid medical assistance plan, there may be reimbursement for those placements. We have an obligation to pay for the cost of care of county residents regardless of their enrollment, especially if it's a court-ordered situation or they're receiving really deep-end services at one of the most, intensive treatment facilities in the state. So there, as you all have said, is not a lot that we can do to react to what is a national lack of community-based mental health services. We feel this quite acutely here in our very remote area. Because of the lack of community-based services, this is driving our staff. Hello, John. His ears must have been burning.
Yeah, how do you say you here, John?
This is driving our increased staffing in recent years following the closure of HDC, responding to some of that lack of community-based mental health services.
Yeah.
We have demonstrated, and I'd be happy to go into depth in that data at our next meeting, how having additional staff providing early intervention services is driving a decrease in out-of-home placement costs because we are able to intervene sooner, connect families with services and supports to prevent out-of-home placement. We are so early on in our development of mental health services that it's challenging to demonstrate that same cause and effect.
Sure.
But happy to share more to demonstrate that point as it relates to out-of-home placements.
I heard an inhale. Okay,
Yeah, I just want to express my total support for mental health services. As somebody who has taken advantage of those services, I know how important it is for people. So my questioning is not saying we shouldn't be providing the
No.
service, or there shouldn't be that
Right,
service.
right.
My question is, are we, as far as the funding and paying for the services ongoing, are we able to bill insurance to recoup some of the costs that we are paying as a county?
Yeah.
Not for state-operated inpatient treatment. We can bill for mental health services, for targeted case management, and we do. And that is a significant source of income for us. But for mental health state-operated facility stays or placements, we report those to the state and hope to get reimbursement based on the state average and numbers, but they're not 100%, unfortunately.
So, I'm sorry, so when we're looking at the expenditures, right, we've got the budget and the actual huge variance, and then when we're looking at the revenues under that, for that same line, those are the reimbursables that we can do, right? It's just the out-of-home or the facility, the state-run facilities that we cannot, so, and it's early on, we're, for the department, with the reimbursables too, so hopefully we're gonna be capturing more of that, or do you have, did you want to add something, John? I'm sorry.
I wanted to make sure I was here in time for the out-of-class
Okay,
reappointment.
okay.
Be here
Okay.
ahead of time.
Yeah.
But I can offer something if you have a question for me.
Attorney Hicken?
My question was, thank you, when, Mr. Dimitrov, when you talk about the state-operated services placements, are these exclusively placements related to commitments for when somebody has been committed for mental health, chemical dependency, mentally ill and dangerous?
You know, that's on the programmatic side of things, and I'm still learning in my position. But that is my understanding, that clients don't just decide to go to state-operated facilities and check themselves in. It is part of a process through the county of residents initiating a process that sends or recommends, or I don't know what the correct word is placing a person in a state-operated facility because that's the best option of care at the time for that person.
And through a court proceeding?
That's my understanding.
Okay.
And it's like, and I guess where I'm going is that's a last resort, kind of, right? So what's our first resorts, and should we be looking more at that? And, you know, that's,
I will offer something.
okay, good, thank you.
These are usually commitment processes, and so when someone presents to us from the community with a degree of they're unable to take care of themselves or make decisions that's caring for themselves or others, then we go through a process to determine if a commitment is appropriate. And so there's an internal process where we talk about that as a behavioral health team. We ultimately then make a recommendation to the county attorney's office. The county attorney's office determines if a commitment is an appropriate response here. We go through those legal proceedings. If a commitment is granted, there's a length of time that commitment is usually good for, and depending upon the circumstances, sometimes people do end up at a state-operated facility. And when those state-operated facilities meet, it generally means that we can't get that healthcare service from a private healthcare system. And often that's going to include issues of safety. So the person might present with some violent tendencies or experiences. It may also include that they are at risk of not staying compliant to the commitment order. So they have to be in a more secure facility. And the goal is always to get them out of that state-operated facility as quickly as possible, but it is a healthcare process. And then the other factor that really impacts us and probably every other county is the rest of the system doesn't exactly have capacity. So in the case that we really, impacted our budget last year was the person was no longer receiving medical services anymore because the medical services we'd gotten to a threshold of this is as good as the person is going to recover. And then we needed to figure out where do they go next under this commitment. And it took a long time for us to find that placement. And so then that cost becomes part of Cook County's responsibility.
I see.
And so it's, and some of this is a learning curve. I was in my first year, and there was probably some things I could have done differently had I been aware of that. We are having some of those experiences currently, where we also have a couple folks that are in state-operated facilities, and I'm paying attention to the same issue of how do we get people to the appropriate level of care appropriately and quickly without us just incurring, this expense of someone sitting there. And but these are not things that I or my team has full control over. We have to work with other systems and, try to make those changes within those systems. Does that help answer the questions?
I think so, yeah. Were any other questions raised, or? Thank you.
Absolutely.
Now, I know I'm presenting 2023, but I'm going to take a little moment to say that in 2024, mental health services through April is at 17% of expenses.
17?
So they're not nearly where we were at
Thank you.
in 2023.
Yeah.
Okay?
Yep.
Any other questions on this slide? Okay. The funding sources for Social Services Department. The federal and state aid made up 30% of the funding for social services revenue, an increase from 2022 when that was 29%. Fees and recoveries funded another 11%. This is from billing health insurance companies for client waiver services, care coordination, targeted case management. Small portion came from non-governmental grants, like the ABHI, the Arrowhead Behavioral Health Initiative, and the remainder from county tax. The Social Services, Children and Family Services staff hours. The number of staff hours in Children and Family Services continued the downward trend due to vacancies in the unit. Social Services, Children and Family Services, number of children in our home placement. Unfortunately, we saw an increase in year 2023 from 8 children in our home placement to 14. This includes children in foster homes, group homes, mental health, residential treatment, or correctional facilities. Employment and training services within the Social Services Department. The PHHS contracts with Arrowhead Employment Opportunity Agency, AEOA, to provide employment and training services for recipients of MFIP and DWP benefits. In the last couple of years, the number of clients who were required to participate in these services was reduced due to state waivers remaining in place since the pandemic.
If I may, Commissioner Mills?
Please.
Comment that this could be another driver of our decrease in open child support cases as family cash programs such as the Minnesota Family Investment Program and Diversionary Work Program. If there's a parent outside of the home, that could be the impetus for setting up an order for support and collection through child support. So it would make sense to see a corresponding decrease in the number of open child support cases if we're also seeing less families locally enrolled in one of these family cash programs.
Can you repeat that or just summarize that again for me?
Absolutely. So when a family applies for MFIP, Minnesota Family Investment Program, or DWP, the Diversionary Work Program, these are two state and federally funded economic assistance programs that provide cash and food support to families who meet certain income limits.
Mhm.
If there is an absent parent in the home and an order is set up through the court system to collect support from that parent who's outside of the home, enrolling in these programs would initiate that, would be a reason to go through that child support collection process to offset the cost that the state is paying for that child to be enrolled in a food or cash program.
Gotcha.
So if we're seeing less families locally, that's a pretty dramatic drop from 29 in 2019 to 4 in 2023. It makes sense
Yep.
that we're seeing that corresponding decrease
Yep.
in child support cases.
Thank you. Yeah, that makes sense to me. What doesn't make sense is the decrease in these. I know people's needs are not decreasing. I know our community's needs are increasing. Families are having a harder time staying here and living here. So it's just what is driving that decrease? Is it the application process? Is it income guidelines not keeping up with, the costs of living, or what's the deal there? So, and maybe you don't want to editorialize that, but that's the part that there's a disconnect in my mind.
Yeah, I think it's fair to assume that local economic conditions don't necessarily match up with the pretty rigid income guidelines
Right.
of some of these state programs.
Yep.
where a living wage in Cook County is probably radically different than many other parts of the state.
Yep.
But there isn't any local
Variance.
variation in
Mhm.
terms of the income limits for some of these programs.
Mhm. Thank you. Without our advocacy at the state level, I guess, right? Like, unless we are actively saying, hey, this isn't working for us, and like Commissioner Johnson pointed out, if we can work through AMC to bring some of these issues up, to have things make more sense, and to get the counties that are more heavily impacted by the formulas or whatever.
Another department within the social services is the substance use disorder services. I shouldn't say department, but another section of the social services. Number of clients served in 2023, comprehensive assessments, 42, treatment coordination, 9, and outpatient participants, 50. How is the substance use disorder services funded? The Wilderness Outpatient Treatment Program contract is funded mostly by a county tax. 18% came from the liquor license fees, which is 1/2 of the liquor licenses fees collected by the county, and 3% from private paying clients or insurance fees.
Question here, if I may, and it's getting ahead of ourselves a little bit. As far as items, like item 6C, for instance, the public health educator is using some substance use prevention grant funds. How will that play into this pie graph?
These are two separate
Okay.
departments.
Thank you.
That would be from the public health
Yeah.
department, and this is from the social. But it's a good question,
there's
because
quite a
these are
over- yeah.
intertwined to some extent,
Right.
but the funding is
Gotcha.
different.
Thank you.
That funding isn't shown here.
Thank you. Yeah, Commissioner Johnson.
Guess I'm kind of stuck in a rut here. So our treatment service fees, those have been reduced this year compared to the trend over the last few years. And what is the reason for that?
They have been reducing for several years, and part of the problem we've faced is that we had staff transitions. We've lost a long-standing employee for a long time who had a really good handle on the billing. And what other challenges we are facing is that we're not receiving insurance information from client on time. And we are, in some cases, billing an old insurance plan, and we are facing difficulty figuring out exactly on what coverage clients have, because not always they have medical assistance or any government coverage. Sometimes it's private, so that's a difficulty. Another is we do enforce the revenue recapture program. In other words, as a last resort, we file claim with the revenue recapture for unpaid fees, but we haven't received much revenue from that over the last couple of years either. So it's a combination of things. It's not just a one item that we can pinpoint and say it's the reason. We have made some improvement of billing processes this year. We've met several times within staff to coordinate and make sure that we have a clear plan of how the insurance information is collected from the clients, how is it entered on time, and how we can bill, generate claims and submit them to the correct payers on time. So because we have time limits to submit those claims. So we do realize that we're a little behind on that, and we've taken some corrective actions to improve.
Aha.
Processing.
Yeah. So I had heard that insurance collection is one of staff's favorite things to do. Is that true? It was totally a joke. Don't even.
I
Are taking it seriously.
What I'm going to say is that I'm committed to increasing our revenue in any possible way.
Absolutely.
And that is an area of, I must say, of an improvement. And as I mentioned a moment ago, we are taking steps to make that happen. That includes more staff training, more access to programs that allow us to confirm eligibility for clients. So there are certain steps we can take, and we know what they are, and we're working hard to make it better.
Thank you for taking that seriously. I was kidding, but I appreciate your professionalism and your dedication to,
Yep.
because that's where it's at, is in the collections, so.
Any other questions on this slide? Okay. Well, we had mental health staff hours, and again, the hours were down significantly in 2023 due to staff vacancies. We did make a appointment of out of class in 2023 to have a vacancy filled for mental health services, but our staff hours were significantly down when compared to previous years. Mental health services clients in work groups. The number of adult clients receiving mental health services has fluctuated in the last 5 years, with a decrease in the last 4. Similarly, the number of children receiving services had decreased in the last 3 years. The client count does have an effect on our targeted case management collections each year. So there was a downward trend in that too, but in 2024, we have increased our targeted case management collection efforts. And we have more staff now too in 2024, reporting the work that they do with clients. So you will see an increase. We already see an increase in targeted case management collections because of the work that our staff does every day with clients. Any questions on this slide? No? Intellectual and developmental disabilities clients in work groups. The number of adult clients receiving intellectual and developmental disability services had increased in the previous 4 years, but saw a slight decrease in 2023, while the number of children receiving these services has been fairly consistent. This also includes clients receiving CADI services, that's the Community Access for Disability Inclusion. Those services allow adults and children to remain at home versus receiving care in different facilities. That helps person lives as independently as possible in the community rather than the facility.
I do have a question, please, if, and it goes back, of course, because that's how my brain works, it loops back, but with the staff hour trends, this is a report on our staff hours, right? This does not, I'm assuming, indicate the demand at all. It's purely because of vacancies, or is that an unfair interpretation? Or
Well, I
an
think
assumption, quite an assumption.
I mean, this graph itself shows how many adults and children are in work groups. But if I understand the question correctly, you're asking, well, is this the true number of all the people that really need those services?
Well, it was the previous slide. When I was,
Oh, okay.
Yeah, sorry. That's where my head always loops backwards. It takes me that long to think, is all.
I mean, again, if I'm understanding your question, you're asking, is that the true number of people who really need those services? That's how is that what?
Well, so looking at the previous slide has mental health staff hours
Oh, you
trend.
okay, you'd
Yeah,
like me to go
there we
to the
go.
staff hours.
And so that is not because the demand is not there, that is because we don't have the staff.
Correct.
Yes.
We only had an appointment and out of class in late of
Right.
2023, and now we just added Lily
Yeah.
under adult mental health. So, I mean, we're gonna see those hours go up.
Staff hours, yeah.
But what also you're gonna see is that our revenue is gonna go up
Right.
for those services, because we are gonna have more targeted case management claims. Not only that, but I think, I don't wanna speak on the programmatic side, but that will have an effect on the programmatic side of things, side too, because we're gonna be providing more services to people who need them.
I'm just trying to, as you guys always are as well, match what our community's needs are with what resources we have. And right now, we have, this is showing fewer resources used, not, and I guess what we have, but not so much the need. And that's where I was trying to get that more comprehensive picture there, so.
Well, I couldn't speak
Sure.
in detail for 21 through 22, but I know in 2023 we had a staff shortage for sure,
Yeah.
because we were down the mental health workers.
Yeah. Director-
Yeah,
Director
if I
McIntyre.
may just correlate those years with the lowest staff hours with turnover in adult mental health case management. We
Yeah.
had staff leave that position both in 2023 and I believe in 2021 as well.
Mm.
Certainly in 2017. I looked at this data for my report on the out-of-class appointment, so we can
Sure.
dig
Oh,
back
thank you.
into that at
Okay.
that point. But I think what's really compelling to me is looking at the number of hours in 2020 as compared to 2023, mapping that against the number of clients in work group on the next slide, I
Thank
think
you.
tells an important story that we are
Yes.
continuing to serve county residents regardless of being severely understaffed. And credit to our team for making that work through a variety of creative ways, including our supervisor taking on caseloads, our out-of-class appointment, staff transitioning within the department and continuing to maintain some of the clients that were on their previous caseload. So I think there are a lot of ways that our team has worked to continue to meet that need without having staff in those positions.
Randa, did you want to say something?
No,
Oh.
I was agreeing, I think everybody's doing a good job and working hard.
Okay, sorry for the interruption. Thank you. Thank you, Allison.
I think I did go over this slide. Any questions on this slide for intellectual developmental disabilities, clients and work groups in 2023? Okay, moving on to adult and home and community-based services, staff hour trend. The adult and home community-based services team experienced turnover in 2022, resulting in less reported hours, but saw a slight increase in hours in 2023. Still below on average for years 2019 through 2021. Home and community-based services, number of individuals receiving services. The adult services also supports our aging community members who need additional help to remain in the community. The in-home support program coordinates local independent contractors to provide homemaking, chore, and transportation services so that people can remain in their own homes as long as they would like. Some of the costs of providing these services are reimbursable through the recipient's waiver. We have seen a steady growth in the number of people seeking these services. However, due to a lack of service providers in the county, there is a waiting list for people to receive this service. Currently, 16 clients are on waiting list.
When, do you recall what year, it can't be that long ago, when we did like the increase, like it was like a $2 an hour supplemental, and maybe there was multiple iterations, I can't remember anymore, but when, I mean, that was an effort to try to encourage more people to meet this need, but was that in 2020 even? Or
I believe it was in 2020 or 2021.
Yeah,
I think
okay.
since the state has adjusted some of those rates that have very moderately increased that rate, it's an area where we have tried to compete with private service
Right.
providers, but it's just not possible,
Yeah.
given the low rates for some of the state and federal waivers and insurance rate reimbursement.
Yeah, effective January 1st, state increased of 2024. They increased the rate from just above 5 to just over 7. I mean, it was a significant increase. It was a meaningful increase.
Right.
But again, I don't think
It's enough.
it competes
for-
with,
yeah,
um,
dishwashing.
they are available.
And ultimately, my personal opinion is it comes down to housing, right? Like, you can pay them another $2-3 an hour or what, but they still can't afford a house here to live here. We don't have the people to provide these, but, step by step.
Any other questions on this slide? Okay. Switch gears to the public health. Again, this includes the child care program as well, but I will break it down further down on a different slide. So this just gives us an overview of the public health department. The costs were 34% more in the budget, and the revenue received was 13% more than anticipated, while the department was budgeted to use $291,439 of fund balance. Lesser amount was needed, $165,861 of fund balance was used. Now, when we looked at the economic assistance team, who as a whole returned to fund balance, social services used the largest chunk of fund balance. Public health was budgeted to use significantly more of fund balance, but they used less. Okay? Personnel had budgeted for use of specific COVID-19 grant funds in 2023, but we were allowed to charge non-grant costs for two of the public health educators to the American Rescue Plan instead, and some of the personnel costs for all public health staff members to various public health grants. This resulted in a lower expenditures in this area, in the personnel area, and while the revenue under personnel services is at 100%. The contracted services cost came at 3% over budget, but also with 13% more in revenue. And the child care program expenses were 6% more than the budget amount. I must add that the wage subsidy program was significantly under budget, $91,638 less than budget, but I'll cover this on a different slide. While we received over $100,000 in revenue related to the child care program that was not budgeted. That came from the DEED grant, the Department of Employment and Economic Development, $65,000. First Children's Finance, $30,000, and Northland Foundation, $7,500. Okay. Public health funding sources. 43% of the funding for public health came from the federal and state grants, 5% from non-governmental grants and donations, and the remaining from county tax. This slide shows how the hours for a public health team are divided between the 6 areas of responsibility under the Minnesota Local Public Health Act. In 2023, the hours were allocated as 39% assuring an adequate local public health infrastructure, 9% protecting against environmental health hazards, 1% assuring health services, 6% preparing and responding to emergencies, 4% preventing the spread of communicable diseases, 41% promoting healthy communities and healthy behaviors. Any questions so far on the public health? Okay. I think I forgot to move the one slide. I'll give you a chance to review before I move to the next one.
Please, Mr. Johnson. Yeah.
What does, I didn't write down what you were saying when you talking, what's infrastructure, 39%? What is that?
This is assuring that we have the proper infrastructure in place in case of an emergency happens. So the public health team is working to ensure that in case of another public health emergency, we are prepared for the events of that happening. And maybe, I could ask Grace to provide some more information. I can follow up in an email if that's helpful.
If I may, I would just add that this is some of the work that our staff does around the health assessment, community health improvement planning, assessing what the landscape of health is in Cook County, not just health care, but the policies, systems, environmental aspects that can influence a person's health, what are considered social determinants of health, housing, access to food. This is a lot of that work in partnership with healthcare providers and community providers to assure that people have the opportunity to be healthy.
Do you want more, Commissioner Johnson, do you want more details from,
Yeah, if
For
it's
Public Health
possible,
Supervisor?
I guess for me, it would be helpful to know how you came up with this graph, the percentages.
I can
You know,
explain
what-
that.
the background of how you came up with those numbers,
Yeah.
what you include and what you put in another category.
So when public health staff does daily work, they utilize a software program to report their hours.
Okay.
And they have 6 different areas of public health that they report under. And so they can choose one of those 6. So that's how this graph was created.
All right, thank you.
Excuse me.
Go ahead.
So infrastructure is sort of like planning for emergencies. It's like having, you've got the right people, you've thought about what your needs might be, and you know exactly where they are, and you're ready to implement resources to help with what might come up.
That's my understanding, but that's on the programmatic side of things. So if you'd like me to reach out to Grace and get some more information, I'm happy to do that. I'm not, I'm prepared to answer financial questions, but I'm not really, I don't really have enough information to answer on the programmatic side of things.
I think that it would be helpful for
Okay.
me to do that if she's got the time.
Yeah.
I'd be happy to comment,
Oh,
Commissioner. I'm
yes.
Connected with Grace via Teams right now. She's tuned in and interested in hearing
Okay.
what's being talked about. So infrastructure would not be limited to public health emergency preparedness, but on a broader scale. Some of that collaborative work with healthcare systems, with regional health systems, the development of our health assessment, evaluating local needs, meeting with community members and groups to better understand what perceptions and experiences are around health within the county, using that to drive our development of the community health improvement plan. So some of that data gathering, evaluation, reporting, community meetings, collaboration, communications, outreach would be public health infrastructure. So some of our age-friendly work in partnership with care partners would likely be under this public health infrastructure. Some of that community level assessment, improvement, planning, communications work.
oh,
Grace?
Hi, Grace.
I was just messaging Allison, maybe I'll just come downstairs. But it sounds like you just explained it.
Thank you.
I was just going to say, would something like setting up the clinics for the COVID shots be part of infrastructure?
So that actually would go under infectious diseases or
Okay.
disaster preparedness. So
Okay.
infrastructure, I can email the board kind of like the MDH definition of what's infrastructure. But it would be like contract management, planning, assessment, partner meetings, the health assessment, the health improvement plan, the public health one, grant making, grant writing, that kind of thing. So it's a lot of kind of like, what happens behind the scenes to keep the wheels turning, is kind of how I think of it. Or like if you're building a house, it's the foundation of the house. And then what you see go up would be like the actual programmatic work. So that's kind of how I understand it.
Mr. Johnson?
Yeah, thank you for that information. So I think it would be helpful for me and maybe others, that these different color things on here, that if we could get detail for how is this happening in Cook County? How is your department right now making sure we have healthy communities? What are the lists of things we're working on? What are the things on infrastructure that we're working on?
Yeah. I could definitely-
Instead of general terms.
So these buckets, this is what MDH requires us to, this is how they want us to divide it up. But I'm happy to say this is kind of what it means in actual day-to-day.
Practical.
Yeah, to make it relatable to us sitting here of, this is what we're doing to make sure we're following MDH guidelines or what they want. Because that's where the confusion comes in. You're using their terms, but I don't know how it relates to what we see when you present a budget.
Sure. Would it be helpful to follow up in an email or with the minutes from?
Yeah, that'd be great.
Okay.
Is that all right? Switch it. No. Also, what I like to look at too is, again, perspective, right? Like, we look at our expenditures, actual is 439, 937 versus our revenues is 268. And so, roughly it's a little under 200, what is it? 200,000 that our county is paying for, right? Our community. And that's about 2% of our overall operating levy. So for when we're talking about investments in our community and we're looking at ways to maybe reduce out-of-home placements or make our community more resilient and stronger is public health is a vehicle for that. Human services is a vehicle for that. The 2% roughly of our revenue, is that how much we want to be investing in some of these more broad community health initiatives and focus, or just where do we want to be putting our dollars? Just from another perspective there, in case that muddies things for us all. No comment, Plamen. Thank you for bopping down, Grace.
Yeah, I'll just hang out here.
Yeah. Thanks, Grace.
Yeah, no problem.
Public health community grants. In public health, these are awarded to community agencies through a competitive annual grant-making process, with 191,000 awarded in 2023. A subcommittee of the Public Health Advisory Committee makes funding recommendations each year, which is presented to the Human Services Board. Grants are made in line with the goals set forth in the Community Health Improvement Plan. These represent areas of essential community services that would go unfilled without support through this grant-making fund. This is the list of the 2023 recipients of the public health funds. Any questions? Also, I should go back one slide. This can be found on page 20 of the financial report, along with breakdown of the public health community grants, the child care program, and expenses and revenues. So if you'd like to dive more into it, and if you have any questions, please let me know. I'm able to answer those at a later time too. That is an overview of the entire department. The economic assistance team, within the economic assistance department, $43,727 were returned to the fund balance. Social services, $708,465 of fund balance was used. And in the public health, $165,861 of fund balance was used. Lesser than the budget, but still some additional fund balance used. In total, $830,600 of fund balance were used in 2023, whereas $656,881 were budgeted. Or, in summary, $173,719 more of fund balance was used in 2023 than budgeted. Now, one note is that we didn't receive an entire tax levy that was budgeted. $43,638 was not received by the department. So that would have reduced that difference amount to a lesser amount of fund balance. But yeah, this is where we're at. What is the fund balance? Any questions on this, first of all, before I move on to the kind of explaining what the fund balance is?
Nope.
Okay.
Thank you.
Okay, so because the county operations rely on the property tax levy, the Office of the State Auditor requires us to hold a reserve account that is no less than 5 months of budgeted operation cost. And that is where 42% comes in place, 5 divided by 12. This requirement allows the county to maintain operations during the first 5 months of the year before the first half of the property tax collections arrive in May and are distributed to the departments. A healthy fund balance also allows the county to fund unbudgeted expenses that arise after a budget has been set. The county recommended fund balance for public health and human services is 40%, highway department 60%, and the general fund target is 75%. On the next slide here, I'm going to show you what 42% of the annual budget, in the blue, that would be the budget for a year. Green is the available reserve for the fund balance, and in red is the recommended reserves of 42%. It wasn't that long ago when our fund balance fell below the state required minimum. However, in the recent year, due to the decrease in planned expenditures and an increase in third-party billing efforts, we have reported an excess of revenue over cost, resulting in the return to the fund balance. In 2024, the budget includes a use of $566,000 of funds in the event of an unbudgeted out-of-home placement, child care subsidy, and but public health does have a healthy fund balance against to the required minimum reserves. The graph shows that in every year we have more than the 42% that's required. Okay. The next graph is going. Go ahead.
Commissioner Johnson had a
No, I'm going to wait.
signal.
'cause
Oh, Commissioner Johnson's going to wait.
Oh, okay.
My answer's coming, I know it. It's on the next slide.
This slide shows now what compares our fund balance, available fund balance, if 75% was required in reserve. So you'll see that in 2020, we are below that threshold, kind of on par in 2021, above the 75% in 2022. In 2023, our fund balance was larger than the budget. And in 2024, our fund balance remaining from 2023 is at 70% of the budget, which is less, of course, than the 75%. But again, better than the required minimum.
That's great.
See, my question was answered.
No,
But,
I don't even know what it was.
well, it had to do, why did you pick the 75? Because that is the general fund number, but that's many departments. What made you
It's for
choose-
illustration purposes. I wanted to show that our fund balance is now, at one point was larger than the budget, but now it's below 75%. But yet better than the required minimum. And the reason is that recently a staff member asked me, well, where do you want your fund balance to be? What is the magic number? And
Three, I think, right?
and without getting into great detail, I think my short answer was, well, not bigger than the budget,
Yeah.
okay?
And what's our fiscal policy? say?
But yet, bigger than the 42%.
Yeah.
But not too close to 42%, right? Because we want to have some healthy fund balance. What is the magic number? I mean, well, again, somewhere more than 42 and less than 100%.
But we discussed this during our budget advisory committee meetings, that we have a fiscal policy that says public health, general fund, highway department, these are what we want your fund balance to be. So if we have a policy, we should strive for that number or change the policy, I would think.
Well, we are striving to be above 42%. Well, the reason for that illustration is partially because I'm in the works of the 2025's budget. And we have to decide how much of fund balance we're going to use in 2025, if we're gonna use any. So this is showing us where we're at. Yes, we do have a healthy balance, but we know how that works. 1 or 2 years of downturn, or 1 or 2 years of more revenues can have a significant impact on the fund balance. So I think it was my responsibility to show to the board where we're at. And because we will be deciding on the next budget here pretty soon, and this will, I think, helpful when we're making that decision. Okay?
Yeah. Thank you. Any other questions or comments, or?
It's going to be on the next slide.
Jeez Louise.
Okay. Again, this is a more condensed version of the 2023's financial report, showing the excess of revenue under the under economic assistance, excess of cost under the social services and public health, which contributed to overall use of $830,600 of fund balance, leaving us with $3,700,370 of fund balance. Now, that is not, of course, our finances for 23 haven't been audited yet. I feel very comfortable about this number, but this number will change once we go through the audit, because the auditors will make some adjusting entries, so there'll be some minor adjustments to this number. So be prepared to see that number change going forward with some small adjustments. Okay? Any questions?
Yeah,
Mr.
going
Johnson.
back, so the slide that we have in our packet, you have Department 470 to 492 balances. What is that?
Those are restricted departments. In other words, those funds have been given to Public Health and Human Services for specific reasons and cannot be used for anything else.
And I appreciate that. It's just, I think, since I've been on this board, that's the first time I've seen that put this way. And I understand, it's fine. Everybody gets to put the information in a report the way it makes sense to them. I just hadn't seen it reported that way before, so I just wanted to double check that.
I meant to say at the beginning and I forgot. This is my first time that I present the finances. I presented the budget, but now I think it's a little different. So I'm open to any recommendations and changes and requests. I've been following a template of how things have been reported for some time, but if there is any other information that you think that would be helpful, or exclude some information but include other, I'd be open to that and open to the way it's presented too. So please let me know.
Commissioner Storley, please.
Thank you. Thank you for this really concise report. I like the system that you put up here. I've seen a lot of them over the years. They're all good, but I would say you're excellent. And I think going back, as you suggested, maybe looking at maybe some areas to put in or pull out, but it was very informative, and I appreciate all your hard work at this, too.
Thank you. If I may, one more comment. Typically, I think these are presented the finances are presented in April. Now, with me being new and on the position, and with us receiving still funds through March, I had reached out to Alex and I said, would it be okay if we presented the finances for 2023 in May? That will give me a little extra time. I might have been able to do it in April anyway, when I look back, but I think my goal for next year will be to do that in April, because I think I'd be ready to do that sooner than May.
Great.
If anyone was wondering, historically these have been reported earlier, why we waited.
Thank you.
Okay.
Questions?
Just thank you for your great report. It was very easy to understand, and appreciate all the time and effort you put into explaining it to us.
Yep. You're welcome.
Yeah, and I think we've made a few comments throughout that for changes or tweaks or whatever, but overall, awesome. Thank you very much.
Yep.
I really appreciate historical perspectives, looking at, the last, what is this, page 21 in our packet on this item, going back to 2016, looking at the 2017 fund balance. It just gives a lot of perspective of where things have been, what happened, what changes we've made, and where we are now. Because it is eyebrow raising to see that our fund balance is larger than our budget, right? But then we need to look back, like you said, not too many years, and it was below where things should have been. And it was a long, hard fight, I know, to get it back up. So, and then here we are. It went way over, and so it's a balance. But just having that longer perspective, I think, helps put in, perspective of where we are right now, and maybe we shouldn't be too reactionary, and try to take that level road for planning ahead. So I'm excited for further budget discussions too.
Looking forward to those.
Yeah. Anybody, any other questions? Thanks, Plamen.
Thank you.
Have a great day.
You too.
All right, that moves us on to item 5, staff updates. Here's the org chart. Allison, do you want to give some comments there?
I'd like to just start out with an echo of gratitude for Plamen for your excellent presentation, the depth of information that you provided on staffing and services, your responsiveness to questions. So thankful to have you in this important role, Plamen.
Thank you.
Here.
Staff updates. Yes, there is an updated org chart included in the meeting materials again this month. You met 2 of our new hires since the last board meeting earlier this morning. Lily Gruber-Schulz started on April 22nd as our adult mental health case manager, and Leanne Avery on the 20th, just yesterday, as our office support and economic assistance case aide. As indicated in the org chart, we currently have 5 vacancies in the department. We have offer pending for social services case aide, so feeling hopeful and optimistic about having that support staff team fully staffed for the first time since last fall. We have invited candidates to interview for the eligibility specialist vacancy created by the resignation of Ellis Walsh. We have one confirmed thus far for later this week. We have reposted the developmental disabilities case manager position and are waiting on any new candidates for that position that was vacated by Julie Kinney earlier this spring. We are also continuing to recruit for the coordinated crisis response worker position that was reposted and closed yesterday, and anticipate a referral list of any new candidates for that position yet this week. Finally, the adult services in-home support position that was vacated following Laura Nelson's transfer to adult services social worker. That posting was just opened up and will close on June 2nd. Any questions on staff updates before I move on to a very brief agency report? Plamen spoke to where we're at right now with regard to expenses and revenues. I can just draw your attention to a couple of areas where we are over, one being children and family services. We are at 59%. Notably, this is much less than what was included in your April board meeting, that 3-month average from March. We were at 50%. So again, don't expect those overages to continue in that area. Similar out-of-home placement cost, we are at 60% year to date. Again, much less than where we were at in March. We were at 50% in March, so again, did not expect those trends to continue through year end. Again, out-of-home placement expenses are unpredictable and variable. We just don't know when a family might experience an emergency that would require out-of-home placement. Caseworks update, we met yesterday with the NCT casework teams and IT and program staff throughout the region to initiate our pre-project planning meeting. All Region 3 counties are moving forward with caseworks for economic assistance and healthcare. We have our first all-staff kickoff meeting set for June 6th. I want to recognize the adult and home and community-based services team for their successful audit. We were recently informed from Blue Cross Blue Shield, which is one of the managed care organizations that we contract with to provide services to elderly residents in the community. We received a report on that care coordination audit, and I'll just read directly from the audit letter. So within elderly waiver, community well individuals, those are people who are living in the community, we achieved a 100% compliance. Within nursing home systems, we've also received 100% compliance. Transitions of care, 100% compliance. Again, directly from the letter, great job on an excellent audit. Regardless of the changes in care coordination staff at Cook County, it is evident they are following our care coordination guidelines. I appreciate your staff reaching out to me anytime they have questions. After achieving no corrective action on DHS audit protocol elements for the past 2 consecutive years, Cook County qualifies to be a DHS high performer for 2024. I will send more detail in the future on what being a high performer means in terms of future audits. Thank you for the time spent on getting ready for the audit. And that is from our partner relations consultant at Blue Cross Blue Shield.
Awesome, that's great.
Big kudos.
Yeah.
Services team. With that, I'm happy to frame up our items for board action before you this morning.
Yes, please.
So the first request before you is from our Public Health Fund Subcommittee of the Public Health and Human Services Advisory Council. This is a request and recommendation to reallocate funds within the original grant amount approved for Cooperation Station. Cooperation Station received $5,000 in the form of a 2024 Public Health Fund grant. This grant was intended to support professional development for staff. However, the organization secured funding for this purpose from another entity and requested to instead use their grant towards replacing portions of the outdoor fence around the play area. They explain that the fence is a safety issue for the program and that replacing portions that are too short or broken will ensure that the children in the program continue to have a safe outdoor play space. For the 2025 grant cycle, we recommend that the Public Health Fund Subcommittee establish a % threshold for future budget modifications within that original grant allocation without requiring board approval. This process improvement recommendation will be presented alongside the 2025 grant allocation recommendations. So again, we're requesting to reallocate funds within the original grant amount approved by this board for Cooperation Station, and as a process improvement for future grant-making cycles to have a % threshold recommended by our Public Health Fund Subcommittee, within which grantee can adjust line items within a budget not to exceed that total grant amount. Happy to take any questions about this request.
So there's one request, two requests.
One request to allocate those funds, and then just a
Heads up.
recommendation
Sure.
forthcoming alongside the 2025 grants.
Okay.
So that we don't have to come to the board every time someone receives other grant funds and wants to reallocate the public health fund.
Any questions? Concerns? Is there a motion here?
I'll move to accept the request.
Thank you, Rana. We have a motion. Is there support?
Support.
We have a motion, or support from Commissioner Sullivan. Thank you. Further discussion? Hearing or seeing none, all in favor? Aye. Opposed? Motion passes unanimously. Thank you.
Thank you. The next request before you this morning is a request to extend an out-of-class appointment for adult mental health case manager through year-end 2024. Again, want to be really transparent about what our intent is for the next budget year, and that is to permanently reclassify this position similarly to the structure within our children's mental health team to have 2 case managers. The extension of Dana's out-of-class appointment is recommended to provide ongoing coverage of adult mental health case management duties on the behavioral health team. While the adult mental health position was recently filled on April 22nd, the extension is recommended to provide continuity for residents receiving case management services, additional depth and coverage within the team. According to the Cook County Employee Handbook, work out-of-class assignments can be ended, modified, or made permanent anytime by action of the board. Again, the purpose here is to provide that continuity of care for individuals that are currently receiving case management services from this individual. In terms of the analysis, I provided some detailed reports on what we're seeing with trends in adult mental health services. We are not seeing a dramatic increase for adult mental health services, both in intakes or in ongoing work groups. You saw that in Plamen's report this morning. We do assess that frequent turnover of that position is a factor, as downward caseload trends align with the years in which the position turned over. We've had 5 different adult mental health case managers in the last 8 years, including Dana's out-of-class appointment. The average length of service for adult mental health case manager based on the last 12 years of data is 4.4 years. As with the reclassification of the children's mental health skills worker to a children's mental health case manager in 2023, having 2 staff in a case management role will provide continuity and depth of service to residents in a critical position that took over a year to fill most recently. That was vacant from February 2023 to April 2024. The difference in the base rate of pay for a mental health skills worker at grade 160 and an adult mental health case manager at 170 is $228 an hour. The additional salary expense would be offset by potential targeted case management revenue. We do not project any budget impacts for 2024 with extending this temporary out-of-class appointment, again, due to the prolonged vacancy on the team and within the broader social services department. Targeted case management services are billable and generate revenue to offset the expense of service provision. Again, page 51 of your meeting materials, I have, going back to 2017, the number of assessment work groups, case management work groups, so those are work groups in which services are provided on an ongoing basis, as well as the number of adult mental health intakes. Happy to address any questions about this recommendation.
Questions, anybody? Really grateful for the recommendation and Dana's willingness. It's much needed, and I think it makes a whole lot of sense to really strengthen our team as best we can. Commissioner Sullivan.
Chair Mills, I'd like to recommend that the board extend the out-of-class appointment for an adult mental health case manager through the end of this year, 2024.
Thank you. We have a motion. Is there support?
Support.
Thank you, Rana. We have a motion and support. Any further discussion here? Hearing or seeing none. All in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you.
All right. Next before you is a request to post for a public health educator, youth engagement, and prevention coordinator. Our recommendation is to begin the process of recruitment for this fully grant-funded position. We were notified that our application was selected for funding for the Substance Misuse and Suicide Prevention Coalition Grant. This award is administered through the Minnesota Department of Health, or MDH, Injury and Violence Prevention Section. The grant award is $125,000 annually for 4 years. This grant is focused on multi-sector collaboration, with year 1 of the grant dedicated to community assessment and capacity building. There must be a 1.0 full-time equivalent prevention coordinator who is leading this process. So we would not be able to achieve the requirements of this grant within our current staffing structure. Again, the purpose of the request is to fulfill the grant duties of hiring a full-time equivalent prevention coordinator to address substance misuse and suicide prevention with youths aged 10 to 24. This is a fully grant-funded position, including salary and fringe for the new health educator position at 1.0 FTE, and also salary and fringe for the public health supervisor at 0.25 FTE. Program supplies, stipends for coalition participants, staff travel and training expenses, and administrative costs are all also covered in this grant. The grant right now is with MDH Legal for review. My intent is to bring that grant agreement to this board at our June meeting. Just to get ahead of some questions I might anticipate from the board, as I reported last month, our intent is to post under the existing public health educator job description. We will develop role, grant, and program-specific job addendums within the public health educator job family, consistent with the process that we're moving through right now with the social work job family. Where will this person work, you might ask? The team has discussed a plan to rotate office space both within the courthouse and with the workstation that one of our health educators is at the community center, as many of these staff are working permanent hybrid schedules and frequently out of the office for training and community events. Again, I will bring that grant agreement to this board next month once it's made its way through the legal department at the Department of Health. Happy to address any questions about this request to post?
Say, for instance, worst case scenario, which is not usually where I go. We approve this posting, and then something happens legally that doesn't jive with us, and turns out we're not going to go for it. We can just unpost, and there's no commitment, and we're not at any risk for following through with what we had posted. So just wanted to make sure, talk about risks. But this is amazing. Thank you for the application and the efforts on this front. It's so important, and what a boon for our community. Hopefully we'll just get applicants and people to fill it. But other questions?
Yeah.
Please,
Okay.
Commissioner Johnson.
So the idea, I certainly think, boy, that it sounds great. So I think with the discussion of mental health issues, this fits in good. My concern is with the process. The grant application stated we will be hiring a full-time person. We just, as a board, last month approved a strategic plan, and one of the items in that plan that we said we were going to commit to is making sure that our departments don't reach beyond their capacity, that we look holistically and think about how do we provide the services within what we currently have without adding more. And the fact that this grant was applied for, stating without board approval that we will hire a person, I have concerns with the process. And then, I've brought this concern up before, that we hire a position based solely on grant funding, but we don't have the financial programming to track those allocations and say, oh, we're going to hire somebody for 4 years then, and when this grant funding runs out, we need to make that clear that that position may not continue because we no longer have funding. Other counties do that, but we do not. So I understand why, Grace, I appreciate your work trying to get extra money for us to provide for services, but I do think we are out of step with our processes of how we go about getting board approval for new positions that will be ongoing and not tied to funding. So that's my concern.
Yeah, that's a good concern. It's almost like a chicken egg situation, right? Like, do you go through the effort to ask us, the board, before we know if we're even going to get the money, or do we get the money and then ask the board if it's okay to get the money, right? Please, Commissioner White.
But did not Commissioner Johnson just say, the process should be that we are informed of it, whether or not we get it, and then they go through and to get the money, which is a very valid thing, but what we approved was this process, and now we're not following it, so why did we bother?
With which part?
Wasn't it, when you said you approved, I mean, I don't know, I wasn't there, but not to increase with the county money, to increase positions, but when it's totally outside, new money, I don't see how that would be an objection, because, 4 years is a long time, and if it's great, I'm sure there'd be more grants that we could get to keep it going. It's like we're not saying we're gonna transfer it over to county money in 4 years. We're saying, for one thing, this is meeting an immediate need, and, I don't see how that could be objectionable.
I think it was the process. Like, I think the objection is just before we apply for it, we should talk about it, is kind of what I think Commissioner Johnson's saying, right?
Correct.
Yeah. So, and yeah, I don't have a problem with that at all. Nor do I have a problem with accepting this money.
I am concerned that you are asking me to agree to post for a position that does not clearly state it is a grant-funded position. And we have had other hires that were grant-funded that when that grant ran out, it came under county levy.
I keep hearing about this, but I have not yet found it.
Well, Grace's department during COVID, there's an example. That has happened.
Which position?
And it also happened in another department, but,
Yeah, I need specifics before I can speak to anything,
but there, you can do the research and find that information, but that's what I'm saying. I have a concern that we don't have processes in place to, and other counties do, so I know it's out there, of tracking this and making sure that we as a board understand what is grant funded, what is levy funded, and it gets blurred in the way our numbers are being presented to us.
All right. Yes, Commissioner Strelly.
Thank you, Chairman. Grant funding requests are very limited. And so I'm thinking when a grant pops up and Grace sees that, or anybody in the departments, you have a week and a half to apply. Where does that
Sometimes.
leave us?
Yeah, sometimes.
We only meet once a month.
Yeah.
I mean, should she send out, or anybody send out a note? Hey, I'm thinking about this particular grant. Mull this over in your mind, talk about it. We could talk about it at a board meeting. We don't have to wait till the health meeting and just say, we've received this information, we're thinking about it, just to acknowledge the fact that there's a time restriction on a lot of grants.
I thought we did talk about it too. I mean, I think it was brought up. I'm just not, there's so many, right?
At each of the last 2 board meetings, I
Yeah.
reported on our intent to apply for
Yeah,
this grant.
yeah.
So-
We didn't vote per se, but we discussed, is my understanding. But is that, you want to vote on it though? Is that what you're, before we apply for grants, or?
But there might be 10 grants that are looked at or considered, and that might be taking up a lot of time to say, should we do this, this, and this, when we have no idea if it's going to come to fruition or not.
Right.
Isn't that right? I mean, it's not just, because you don't know, when you see an opportunity, you have no idea, are you going to get that or not?
Mhm.
Just to ask permission to do it, I don't know.
Mhm.
I have a question.
Commissioner Miller?
Do they really only give you a week and a half when there's a grant opportunity out there? Is that not normal? I don't know what it's like for.
Hopefully
for
not. Hopefully they give us a great deal more than a week and a half, but it is time limited. It's usually somewhere, I would say, between a month to 2 months. But I would say, so within PHHS public health team, the grant funding mix is dynamic. I'd say we typically have maybe between, this is where Plamen should be back chiming in, but between 15 and 20 grants that, yes, some of them are more limited in duration than others, and others are ongoing. And so within our team, part of what I do with Allison and with Plamen is we identify when a grant opportunity comes up, whether it'll fit within the goals of our health assessment, whether we have the capacity to apply, what it would mean to apply. And then when we do keep tabs on when a grant is ending and say, oh, we know this grant is ending, then maybe we'll have more staff capacity to take on other grant-funded work. So we are very proactive at looking at funding to off-source, not off-source, but to support the operations of our team without having positions go back to being, levy funded. We do have some levy funding supporting the work of our team, but we do also pretty aggressively, I would say, go after new competitive grants to support our work. And I'm happy to adapt to the processes that the board puts in place for notifying you all of our intent to apply, or whatever this group comes up with. I'm happy to adapt our processes as needed. But that's, I guess, just a general overview of how we approach grant funding for supporting the work that the positions in our team take on.
Thank you.
Yeah.
Oh, I'm sorry, Commissioner Sullivan, did you have, I saw your hand, or,
It was answered.
okay, thank you. Did I hear your voice, Allison?
Yeah, just to add on that, we would be looking for specific direction from this board or from the county administrator if we were looking at having some continuity across the organization with how grant-funded positions are posted. I know Public Health and Human Services is not the only department that has grant-funded positions. To my knowledge, we haven't had any stipulations around the length of appointment for those positions, so would want to see some continuity across the organization and
Sure.
specific direction from this board or administrator on how to approach this going forward, so that we don't have to go through this every time.
Sure,
Yeah,
yeah. It'd be
that makes
helpful
sense.
to have that kind of grant-funded position map for the county as a whole, not just, but for each department, yeah, or just see where that comes from and goes. And because I recall it being brought up that we've had grant-funded positions kind of bled onto the county levy, and I just haven't found that specific yet, so it'd be worthwhile talking about that. But,
I would add one thing that's unique about this position is that it is fully grant funded. Typically, the way that because we're small, we typically don't get grants that are this big to support a full position. Typically, we're working under, 2 or 3 grants for one staff person. So in some ways, this is pretty tidy in that, this is fully funded by one grant. One person is doing the work under one grant versus one person working under 3 or 4 grants.
Commissioner White?
Just a question, Allison. So then when the job is posted, is the hiree or during the interview process, it's made very clear that in 4 years without additional, this is a 4-year job you've got that you can count on?
That has not been our practice. Based on the level of turnover that we've seen, based on the challenges in filling positions, I would be reluctant unless there was specific direction from this board to advertise positions as temporary or having term limits associated with grant funds. And again, would respectfully request that that be applied organization-wide.
Sure. Okay. Other questions? Do we need the motion here?
Mr. Chair, I'll make a motion to post and hire the public health educator, youth engagement prevention coordinator in PHHS.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
Support.
Thank you, Commissioner Starley. We have a motion and support. Further discussion? Commissioner White?
Just one little question.
Yep.
I think it's more honest to tell someone you're hiring that this is a new program and we're, of course, absolutely, it's needed and we're excited about it, but it really is dependent on funding, or we're going to ensure that you will have this, assuming your job performance is adequate, you will have this job until, regardless of when the grant dollars run out. I don't know. What has happened in the past when the grant monies, I should have asked this before, when the grant dollars run out and the program is doing well, what happens?
Our process has been to seek out additional grant dollars to support that program ongoing. An example would be the age-friendly work that we've done in partnership with Care Partners. That was a grant-funded, time-limited project. It was limited to a portion of one employee's work. We applied for additional expansion grant dollars to continue that work. As with healthy housing, that was a time-limited grant that offset the expense of one employee. We applied for additional funds to continue that work. I think the more that we demonstrate to the state and other grantees our capabilities as a department, as a community, to address some of the most pressing needs, and using data and community input and staff input to drive our program, service, and staffing recommendations, the more well-positioned we will be to continue to seek out grant dollars to continue the work, or reevaluate because needs could change as well.
Success builds success.
And I think, can I say, too, I think some of these grants like this would be looked at as preventative if you're serving, say, youth, when they're in their teens, they prevent certain problems that might show up when they're in their 20s because they didn't have this service. So, it's really a lot of unknown impact, but I think the potential is really high, too.
Substance
To be
misuse and
very
suicide
positive.
prevention. Yes. Great. All right, further discussion. Yeah, time. All those in favor? Aye. Opposed?
Nay, and I just want to say, it's because we're requesting to post for a position prior to seeing the actual grant agreement. To me, it's the process, cart before the horse again, not against the grant and what it's striving to do. Just want to make that clarification.
Motion passes 5-1. Thank you. We are beyond time here, so I'm going to ask the committee reports, unless someone has something that must be brought up, talked about. Okay. That moves us on to the last item, adjournment. We are adjourned. Thank you.